The coronavirus pandemic continues to wreak havoc on the airline industry. As COVID-19 cases spike globally, passenger demand for air travel has collapsed, and the International Air Transport Association, which trades with the world's airlines, says carriers could lose at least $84 billion this year. IATA's Director General and CEO, Alexandre De Juniac, is with us now, and we're going to break this all down. So, Alexandre, at what capacity are airlines operating at the moment, and why must governments act fast, if they can, to provide relief?
You know, in Europe, in the Americas, and last month in Asia, the traffic drops by 80 to 85%. So we are operating at, let's say, 10 to 15% of our capacity. In Asia, it's slightly more.
AAA, though, says that Americans will take 700 million trips this summer, but the good majority of them will not be jumping on a plane to do that. In the meantime, a recent IATA poll shows that passenger confidence is a key factor in that decision. People are kind of choosing staycations or places that they can drive to instead. That's got to be a challenge for the industry. We've heard a lot about the quality of air on planes, and we've seen what airlines have done in terms of trying to protect passengers, demanding that people wear masks or requiring that they wear masks, but still consumer confidence is pretty low.
In fact, the important point is to restore passenger confidence, you're right, but also to gather the acceptance of authorities to lift travel restriction or travel bans. So what we have done is, within the International Civil Aviation Organization and with the contribution of the medical community, mainly the WHO, we have set up a set of measures that are applicable, or should be applicable everywhere. It's a multi-layer approach to control the health and make a sanitary checkup for passengers, to minimize the risk of catching the virus on board, but also to minimize the risk of virus transmission from one country to another. So what we urge government to do is to implement these measures and not to take quarantine measures that are a complete deterrent to any travel. When you implement quarantine measures, it's equivalent to implement a travel ban.
So I guess it's an important point that you make, Alexandre, about the way the coronavirus is transmitted through air travel, if it is at all, and what steps airlines can take to help rebuild passenger confidence. I'll just speak just personally. We were planning on taking our entire family to South Africa for safari at the end of the year, and those plans are in jeopardy now, not because we worry so much about the travel within the plane, even though we're talking about a 15 to almost 24-hour plane journey, but about all the different factors that go into traveling today, which includes the airport and the lounges and all sorts of people that you come into contact with. So how can airlines or the airline industry help rebuild passenger confidence? I'm speaking for my mother here.
No, but that's a very topical question. The measures we have proposed, they are not only for the aircraft or the flight. It's for the entire journey, and it starts before going to the airport with a health declaration. Then at the entrance of the terminal, you have a temperature check, and then you have a mandatory wear of mask in the airport during your whole stay on the ground, and then a mandatory wear of mask on board, and then a temperature control at the arrival airport. Plus, you must know that you will have a simplified service of catering with prepackaged food. The aircraft will be sanitized with special products and methodology that are antiviral products. So we are doing that for the passengers to not to have risk to catch the virus. It's to minimize the risk. And I think we can say that flying will be safe, is safe, and will be safe. You know, safety of passengers is, as always, is and will always be our number one priority. So we would not recommend to fly if it was not safe.
So you just mentioned how, instituting any sort of quarantine would be basically the equivalent of a travel ban, because who, has the ability to fly someplace, spend 2 weeks and, not doing anything and then kind of enjoying your vacation. You may have heard that 3 states in the Northeast, New York, New Jersey, and Connecticut, have started instituting mandatory quarantines for people coming from other states that are showing a rise in coronavirus cases. So you just presented us with a list of really interesting things that the airline industry can do to minimize the spread of the virus. So I'm going to push back and say, well, what's more secure than 14 days without interacting with any other person? That would be even more effective, wouldn't it? And why do you think that a 14-day quarantine is going too far?
No, what we say is the following. Our research, and it's common sense, shows that if you impose quarantine, you ban travel. And your colleague mentioned that he wants to go to South Africa for a safari. I'm not sure that he wants to spend 2 weeks in South Africa in a quarantine. I don't think so. So it will be we say that it's a major deterrent. And if we implement the measures we have put together, we think that it is safe, and it is not 100%, but it minimizes the risk of catching the virus. Additionally, I would like to mention that if we want to be even safer, we should probably aim at testing passengers. But the test system is not ready. Whenever it is ready, we will ask for tests. For passenger testing. And when I say ready, it is reliable, scalable, fast, and comfortable. But it's not the case. The positive part of what I am proposing is that the medical community, the scientific community says that this testing system should be ready. It's a matter of weeks. So I am pretty optimistic.
And I guess finally, Anne-Marie pointed out that there are some travel restrictions that are being enacted here in the United States, but we also understand that there are some countries in Europe who may put travel bans for Americans, which is quite remarkable when you think about how Italy and France and Britain were at the start of this pandemic. They've been able to control the pandemic. Clearly, countries and the leaders of those countries are seeing the inability of this country to contain the pandemic and are rightfully worried about infections from Americans to their citizens. So I wonder if Mr. Macron or Boris Johnson talk to you and to your organization, or do they sometimes make these decisions in sort of a vacuum without consulting you?
No, frankly, they haven't consulted us. They should have, probably. The point is that it's mainly a political decision that has not been made. As you know, the decision is still ongoing. In many areas of the world, to restart the operations, countries have established what we call health corridor or safety corridors between 2 countries or 2 destinations, in which they test some processes for health control. Perhaps that could be a solution if we don't want to ban American citizens to come over to Europe. That would be a pity, and we think that we should not do that. That if we implement the right processes, we should reopen borders, provided we implement the right processes that we have designed with the input of the medical community and the WHO.
Alexandre De Juniac, thank you so much. I think it's actually really, really interesting, the options that you have presented, including, Vlad, the idea of actually being tested for the virus, not just for fever before you get on a flight. That would be amazing if that could be done. Thank you so much.
Thank you.